Good morning, everyone. Good to see everybody out here. I'm Dr. Jay Henry. This is Dr. Morgan Murphy. We practice in a group optometric practice just outside of the Columbus, Ohio area. And we're here to talk to you guys a little bit about AI technology, how it can enhance patient care, how it can actually enhance your office efficiencies as well, okay? First of all, we just want to thank MaximEyes for bringing us out here, bringing us up to talk to you guys today. Obviously, we're longtime MaximEyes customers, so we are going to talk quite a bit about their software, but also some of these integrations can be used in other softwares as well. So just a thank you to those guys for bringing us out. Just a little bit about AI technology in general. So let's just give kind of a quick breakdown where AI technology is headed, where is it in eye care, what can we use it for? It's really about improving efficiencies. So it can do a lot of different administrative tasks for us. It can schedule patients. It can do automatic benefits checks for insurance eligibility. It can do data entry. It can do scribe. It can do dictation type stuff. It can do billing, letter writing. It can start with the patient and schedule them and all the way through checkout and bill pay. Use AI technology to help us be more efficient with that. It's really, really cool technology. We're super excited to talk about it. We've used all of this in our office currently. So if you have questions or something, ask us during the lecture or even afterwards, we'll stick around. But it really can improve the patient experience as well. So it makes it more seamless to the patient, and it really makes your staff a lot happier with their jobs because they can spend more time with the patients directly face-to-face instead of doing a lot of the data entry that AI can do for us. I think one point there at the bottom that I really want to talk about though, you know, this AI technology, it's not out there to replace staff members in their jobs. It's to augment their job, to make it better for them, to make it easier for them, to make it more efficient so they can do the things they want to do and spend time face-to-face with the patients. So I think that's a really important point to talk about. You know, in general, as you leverage AI technology in healthcare, where's it headed? Where's it going? It's got the potential to just revolutionize healthcare in general. It's not just in eye care, it's across healthcare in general. It's going to make personalized treatments better. It's going to streamline our operations. It's going to improve all of our efficiencies. It's really, really awesome technology. The goal is to make patient-centered care with intelligent management, intelligent engagement with the patients. Okay. Game plan. We're going to walk through an encounter with a patient, start to finish. So we're going to start with the patient scheduling using AI technology. We're going to look at insurance benefit authorizations and integrations. We're going to talk about phone systems and integrations. We're going to look at AI scribes and that kind of stuff. And we're going to get all the way through the end where they can use AI technology to even pay their bills and get information about stuff they've done. So we'll walk you all the way through an encounter and through an exam, both from the staff point of view and also from the patient point of view. So this stuff is really, really cool. So we just want to make sure we have time to get through it. So we were going to kind of jump through and start doing this. Anything that you want to add real quick, Dr. Murphy, before we jump in?
No, we're just super excited to share this with you guys. It's been a real game changer in our practice. It's absolutely incredible what they've been able to do. So we're excited to show you.
And our staff love it. So that's, you know, it's always the question mark is how does staff feel about it? And they love it. They can't imagine taking a step back without it now.
Yep.
So first thing we're going to talk about is the AI technology, EVAA, the virtual assistant, okay? EVAA can do a lot of different things. It can schedule patients. It can intercept voicemails and busy phones and actually reach back out to the patient with a text or a chat message. So that's really cool. It allows patients to check the status of their glasses orders, their contact lens orders. It'll let them check their account balance. It'll let them pay their balance. It can do insurance verification, insurance changes. It can update patient information. EVAA is your virtual assistant. It can do all the behind the scenes things for you. The beauty of it is it works 24/7, right? Never takes a day off, it's never sick, it's never grumpy. It just works behind the scenes always. Yep. Can't say enough about that. So patient scheduling, let's start with that patient. First thing that we need to do, EVAA needs to schedule a patient for. So as we walk through this thing, not only can it schedule, but they can check when their appointment time and date is. They could cancel an appointment, they could reschedule their appointment, all using this EVAA virtual assistant. 24/7, able to do it. It's when it's convenient for the patient, right? They don't have to call when you're open. They don't have to worry about waiting on the phones. They can do it from their own house in the evening or whenever. And I'll just take a quick side story here with that EVAA. So we were sitting, we had a patient come in. I think it was a Tuesday morning. It was like 7:20 a.m. Patient came in, you know, why are you here? I broke my glasses last night. He's like, actually, I was laying in bed. It's like 10 o'clock at night, took my glasses off. He's like, I rolled over, I broke them in two. And I thought, oh my gosh, what am I gonna do? I have to work tomorrow. I need to see what I can do about getting in to see Dr. Henry. He's like, I went to your website to see what time you guys opened. I saw you open at 7 a.m. He's like, and then this little virtual assistant popped up on your webpage and he goes, I was like, okay, well, what can I do? And he said, can I schedule an appointment? And he went through the process and he scheduled an appointment. He put in all his information. He put his insurance information in there and he went ahead and did that at 10 or 11 o'clock at night. and he was in my exam chair at 7:20 a.m. the next morning. That spot would have probably never got filled because we opened at 7. So, you know, it was a late Monday night, canceled, patient canceled out. We didn't get it filled. Eva did it for us. So, I mean, it was great for the patient. They loved it. It was great for us because we had a patient in our chair. So that's the kind of stuff Eva can do for you behind the scenes. This is what it looks like for that patient. So this was our website that pops up from the bottom right-hand corner, and it's a little virtual assistant. It pops up and says, hey, I'm Eva. I can help you do lots of different things. Once you go into that and you click on it and say, hey, I want to go ahead and book an appointment. Super simple for the patient to walk through this. It comes up and it says, hey, are you sure you want to do this? Yes, I want to book an online appointment. It asks for some information. Obviously, they got to put their name and their birthday and that kind of information in, a phone number in there. It does a verification to see if they're actually your patient already, and it matches them up if they are. If not, they can actually, as a new patient, create a patient record in your system as well. So once that happens, there's a verification. It sends them back to their cell phone, makes sure they know who they are. They can pick, if you have multiple locations, what location they want to be seen at. They can pick what provider they're going to see and then what their reason for their appointment is. And then they can get to the calendar, and from there they can start selecting dates, and they will be able to see all open appointments. So here the patient was able to say, hey, I want a morning. I'm going to go ahead and pick that 11:30 time slot. Why are you coming in? Hey, I need new contact lenses. I need new glasses. I have whatever's going on. It then comes up and says, this is the insurance we have on file for you currently. Is that still active? And you can say yes or no. And you can actually click add new insurance. If you have a different insurance, you can take a picture right there on your phone of your insurance card, and it'll upload all that information back into the EHR for you, okay? So then the patient just gets a little pop-up on Eva that says, okay, you're confirmed. You're with Dr. Henry. Of course, I was the patient also. So Jay Henry has an appointment with Jay Henry at 11:30 on this date. And then they get a text message after that that says, you're confirmed. Please click this link to do your online patient information. So that's gonna include things like our billing policy. Maybe we use an Optomap thing that says, hey, we have this technology, we want you to do this. We send them the HIPAA policy. It goes on and it does their demographics so they can update all that information for you. It also goes on and does their health history, their medical history, their current eye symptoms, all of that right from their cell phone. So they're doing all this stuff at home instead of in your waiting room where it takes forever, right? Yep. So that's a huge, huge time saver in itself. Okay. Anything you want to say about the scheduling piece before I jump into what it looks like on the office side?
No, just the patient feedback has been awesome. They love it that they can schedule at any time. They don't have to call our office. You know, we've all been there 10 o'clock at night. We're sitting there and we're like, oh man, I need to make an appointment for this. I'll do it tomorrow. You forget tomorrow. And so it's been really cool. We've had like I said, you said, the schedule's been full more than it ever has been. You know, those last minute cancellations or even us just adding in extra spots in our schedule. It's been
We're
great.
a busy office. Our schedule's typically full, but it's those last second cancellations that get you.
Something happens.
And now we can fill them. Honestly, patients are filling them for us without us doing anything.
Yep.
So really cool. So we're going to jump into the EHR from here. So that patient did all that stuff on their phone. So what happens on the EHR side? So as you're inside your EHR, it will pop up down that lower corner and say, hey, there's some online appointments that have been made since you last kind of came into the EHR. You can see down there we have 3 that kind of are pending. So it also has a little work queue on the left side of the EHR, which also has that 3 there. You can kind of see 3 online appointments to review. So this is just so that these online appointments don't just get stuck into the schedule. They do go into the schedule automatically, but then we review them to make sure they make sense. You know, if they're coming in for maybe an emergency or a red eye, but they somehow got stuck into a full slot, we can change that. Or if they got with the wrong provider by mistake or something happens, we can correct that. But it just alerts us to the fact that these patients are in our work schedule. You can see those 3 there on the bottom one. Remember, I made that online appointment for 11:30. You can see it. It's actually in the schedule. It's done. All we have to do is go through and review it and make sure the patient information's right, insurance is right, everything's good. And then we check off that it's done, and that little red globe turns green. So now we know it's done, and those numbers start to drop off, and then we have 0 online appointments to see. Okay, so it goes right into that EHR for you. It's just awesome. You know, what does this do as far as time savings? What's the return of investment? You know, whenever you launch new technology, the first question is, 1, does it work, right? And we're obviously here to tell you it works extremely well. And then number 2, like, are patients going to use it, right? You have it, but does anybody actually utilize it? Well, here's what happened with us. So we launched this, I think it was back the 26th of August, get the right month here. Our launch day, the first day we kind of just sent a mass email out to patients, said, hey, we've got this new technology. Here's Eva. We want you to start using it. It can do all kinds of things for you. We had 400 plus conversations with Eva. So chats with Eva from our website, 400 conversations in day 1. I mean, that's huge, just the first day. We had 18 appointments scheduled on day one using that technology, just on day one. Our data on this is only up through about 2 weeks. We've had 1,000+ conversations now with EVA, and we've had over 50 patients, and I think now we're up to 3 or 4 weeks of using it. We've got 100 to 150 appointments scheduled using EVA. So what does that mean? It means decreased phone volume, right? Definitely not as many people calling to schedule appointments, not taking staff time to do those things. It's working in the background for us. Such a cool technology. It's saving us a ton of time. So we're trying to figure out, and we have the stats on our phones, and we'll talk about that here in just a minute, but as you do this stuff, is EVA gonna grab 10%, 25%, 50% of those phone volume calls? We're working towards that. We think it's gonna end up at being 50 to 75 or more percentage in our office. It's gonna be high. People are gonna use this and they're gonna love it, and it's gonna grow and grow and grow as we see it. So we talked about scheduling. We'll get to the order status, the general questions, all the other stuff EVA Virtual Assistant can do in a little bit. We wanna talk a little bit more about the review on investment here. We can track our phone call volume, and we'll talk about our phone system in a minute, but we know we have 60+ scheduling phone calls a day. They take 5 to 10 minutes to get a patient in the schedule. That's 10 hours a day of staff time, right? We know we have 20+ questions about bills a day. That's about 3 hours at staff time. We know we get about 15 minutes or 15 calls about, hey, are my glasses ready? Are my contacts ready? Or I need to order stuff. And then we get those general questions. So that ends up being another, 100+ minutes, 75 minutes a day. That total 1,000 minutes a day, right? 16 staff hours of just being on the phone, answering questions. If we can get EVA to start doing that, and this is a summary of those phones, calls, conversations broken down by what they are. If we can get EVA to start answering those 50% of the time, we're gonna start saving a ton of money. Staff hours equal money, right? So, you get 320 hours of staff time a month just on the phone. If your staff salaries are $14, $15, $17, $18, $18 to $20 an hour, you can plug in your numbers, but you can see the cost of their time being spent just on the phone where they're not engaging face-to-face with patients in the office, okay? If EVA does 10% of those, 25%, 50%, you're gonna save, over $3,000 a month in staff time and staff salaries per se. Again, we're not replacing staff with this, but we're able to use them to utilize in the office to do face-to-face things. That's where we make our money, and we're more efficient that way. If you can get EVA all the way up to, 75 to 100%, you're saving $6,000, $7,000, $8,000 a month in staff costs. Huge time saving, huge efficiency boost. It's incredible. It's honestly incredible.
Well, and it's funny that you say that because we've actually had our staff members go, you're still gonna need us, right? Because their workload has been decreased significantly already.
The phone volume's gone down.
Still need you guys. We're not getting rid of anybody, but just the change that they've noticed in the improvement in this short amount of time. I mean, they're happier. And how do you put a price on?
They're ecstatic.
Oh, they're thrilled with it. So it's great.
So we'll talk, just kind of jump in case we're not using EVA and a patient actually calls the office about our phone system. So we use Mango phones. They're integrated fully with MaximEyes. Again, a really cool technology. This also saves our staff a bunch of time. So when someone calls, down in the lower right-hand corner, it pops up and tells you who the caller is, right? It says inbound caller, Morgan Murphy's calling. From there, without doing anything, doesn't matter what you're doing in the EHR, one click of the button, you can either schedule that patient or you can jump to their patient record. So you don't have to search, you don't have to go, I didn't understand your last name, can you say it again? What's your date of birth? And you know that process. All of you staff members know that process. Now you don't have to do it, you know who they are. If you want more information about that patient, you can click the little arrow, it pops up, and it will tell you, Morgan Murphy, she was last seen on this date. She has this going on, her next appointment is this, her balance is this. You can see everything you need without even actually going truly all the way into the EHR. So one click of the button, time saver, huge, right?
Yep.
You can also make a phone call to the patient from within the EHR. That little, it's a Mango up there because it's Mango phones. It's arrows pointing at it. So Donald Duck, if we want to call him, we just click that Mango and it will actually dial Donald Duck for us right from our phone system. And we can talk to him without looking up the phone numbers, without going anywhere else and doing it. Just little things that save us time. So that integration is huge. Couple of clicks, we're into where we need to go. Future use, we're also gonna be able to get transcriptions of those phone calls. We're gonna get sentiment ratings using AI technology to say it was a good phone call, the patient's happy, or it was a bad phone call, patient's sad. And then we can use that to do staff training or maybe to reach back out to a patient and make an unhappy patient happy again.
Yep.
The technology and the AI use is just phenomenal and really cool stuff.
Yep.
So we'll talk a little bit too about EVA, back to EVA. She can also do voicemail stuff. I said that early on. So if a patient calls the front desk, they're busy, they don't answer, it rolls to voicemail. And hey, I'm Jay Henry, I want to schedule an appointment, leave that voicemail. Instead of staff having to pick up and call the patient back, EVA can actually pick up that and will reach directly out to the patient, send them a message on their phone and say, hello, I'm EVA, I can help you. What can I do for you? And this is kind of what that looks like. So they get a message that says, I'm the virtual assistant for Herman Henry Eye Care. You click the link and they're right back to where I showed you that first kind of screen where they can schedule or book an appointment, cancel an appointment, pay a bill, whatever they need to do. So it's responding to the voicemails instead of us. Again, just huge time savers, right? So that's getting the patient scheduled. That's kind of how that whole workflow works. Now, they're in our schedule. We want to know what their insurance eligibility is, right? Are they eligible for something? Do they have an eye exam eligibility? What is it? Have they met their deductibles? All of that kind of stuff. Well, EVA Billing Assistant can do that for us, and it works 24/7 behind the scenes as well, okay? So it does eligibility checks. What it can do is it can go out behind the scenes. It runs 24/7, runs overnight. You can set it to run 3, 4, 5 days out, look at your entire schedule, and go out and find all the insurance benefits for the patients on your schedule. It is fantastic. It does vision, it does medical. You can use it for emergency appointments. If someone's same-day appointment, you can check their benefits and know if they have a copay, know if they met their deductible or not. You can capture all that income on the spot instead of saying, well, we'll send it to your insurance and we'll send you a bill later because we're not sure. You'll know. This is kind of what it looks like. You don't have to log into a bunch of different websites. It runs inside our EHR, runs 24/7 in the background. It does IMED, it does VSP, it does Medicare, Anthem, Aetna, you name it. It does hundreds and hundreds of other medical insurers. So it does the majority of them for you. Eventually, it's going to do payment postings. It's going to do claim submissions. It will work claim denials down for you. It will help you with everything. Right now, we're using the insurance eligibility tool. This is just a day in our office. It's a slower day. We had 51 appointments. You can see in the green there, verified 47 of the insurances for us automatically. 4 failed. They actually didn't fail. Those 4 patients didn't need their insurance pulled because they were things like post-cataract checks or return for dilation or something of that nature where they just didn't need it. So actually it got all of our insurances for us on that day. Inside the EHR, what this looks like, that's our schedule for the day. And we had to blank out all the names, so I know it looks weird. You can see where that red arrow is. That's the eligibility authorization that got pulled in for that patient. You can see the highlighted yellow, it's Medicare. And all the way over, you can see what their benefits are. It's kind of small there, so I'll pop it up here. If you click on that little, where that red arrow is, it opens up another screen and shows you that information. So this was Medicare. You can see the patient, it says they've met their deductible, they have 0 remaining. They've spent $257 on their deductible already, which that's the Medicare deductible in Ohio. So they've met it. Everything's gonna be essentially covered as far as deductible goes now for that patient. You know, what's it look like for a different patient? Here's Vision Service Plan. Again, if you click where that red arrow is, it pops up what your VSP authorization should be. It's integrated in the system. It's already there for you, done automatically. IMED, same thing. You can click on the little red arrow next to the patient who has IMED. And this is all real patient data, guys. So this is what it looks like. It's embedded in the EHR. It's there for you. We did nothing. We never went to the VSP website. We never went to the IMED website. It's just done.
Yeah.
Awesome, awesome. This is probably my staff's favorite thing. You know, they love it. They're like, man, where's this been? We can't believe this. This is awesome. So we pull 60, 70, 80 authorizations probably in our office for a day. 4 to 5 minutes at least, probably, if you had to go to all these different websites to find them and pull them in and then either scan them or download them and attach them. We don't do any of that, right? It does it for us.
Yeah.
It's 4 or 5, probably 6 or 7 hours a day of staff savings. Our insurance person who does this for us is actually getting ready to retire. We'll probably replace her with a part-time staff member, but honestly, this is doing that job for us. It is fantastic.
Yeah.
It's a life changer, honestly. It's so cool.
Yeah, it's been a big thing for us.
Yeah.
That's
all right.
huge. Yeah.
I've talked enough. I'm gonna turn it over to Dr. Murphy for a few minutes to let her kind of roll with it. Here.
You
Okay, I'll keep clicking.
Yeah,
All right.
you got it. You're doing great. So one of the newer technologies that we've just recently gotten is the IntelliScan. This is really cool. So we can scan a driver's license and insurance card. It reads the data off of it and imports it directly into our system. So no more typographical errors. Staff work time obviously is a lot faster than typing out, all those group numbers, those ID numbers, that type of thing, putting them in the right spots. So here you can kind of see, this is what the data entry screen looks like. I was super proud of my picture on my driver's license, so we went ahead and used mine. But you can see where it pulled in my data, all of those yellow highlighted spots, name, date of birth, address, all of that. On the bottom there, you can see that's where we would scan an insurance card, and it would read that insurance information and pull that in. So we're not relying on the patient to provide that data to us. Again, no more mistyping or reversing letters, numbers, that type of thing.
Yep.
So we've really kind of streamlined this process and reduced any errors and saved us a lot of time on this process.
And this is assuming the patient didn't do it already on EVA from their phone.
Right.
So this is when they walk in and we're like, oh, we didn't get your insurance information, or we don't have your address proper.
Yep.
So when they walk in to do it.
Exactly. So we also have a lot of really cool technology embedded within our exam workflow as well. So we are able to create customized workflows. So these are completely customizable. There's tons of different options. You can customize them per provider. So if you want yours to look different than I want mine to look, Dr. Henry utilizes text. So we've kind of streamlined that process for them. We've put all of the data that the tech would need to enter on one page, so the tech doesn't have to click through multiple different segments of the exam. You can arrange the elements to look like what you want. So here you can see this is our setup. Those are all of the different exam encounters that we've created. So obviously for, a DFE, we don't typically need a refraction in there. But the nice thing is, if you did get to that point, you can either change what you want to use, or you can add a refraction on the fly. We have that option while you're in the exam encounter to change and add a new element to it. And then you can kind of see, you don't have to go back, but you can kind of see like there's anterior segment, posterior segment. That is how ours looks, but yours could look completely different than that. And then at the end of the exam, we have automated coding. This one is really, really cool. So this also is customizable, but you can use trigger words so that ICD-10 codes will pop up based on that trigger word. So if I put PVD in the exam, it'll pop up the code for PVD at the end when I'm entering my assessment and plan and procedure codes. So you can, again, customize this completely. You can link codes to certain words, and you can also link documents and assessments and plans to automatically
assessment and plans is a huge part.
Yeah. So I mean, with just a couple clicks, you have your data entered, it's coded, and you have your assessment and plan done in any documents you want to send to the patient. So again, the time savings on this one is huge. There's less clicks per patient encounter. The workflow is easier. You know where everything's at. It makes sense to you. You fly through it. We've been able to see a lot more patients in a day just because that clunky charting isn't there anymore.
Yep. So that's a lot of advanced technology, but let's get into the cool stuff. This is
really cool stuff.
The AI stuff.
So
let's talk about this.
Yeah, I've gotten the privilege to start working with the EVA Scribe. This is really, really cool. So the EVA Scribe, we have a voice recording. We have a picture of it here in a couple slides. But basically, it listens, it transcribes the entire encounter with the patient. So you'll get a transcription, and then it will basically read through that transcription and create a SOAP note for you. And then you just click finalize, pop it into your chart, done. Hey, have a great day, see you later. It supports good compliance with billing and coding because all of those details are in there. It doesn't forget data. So, I'm bad about when I used to chart, I'd get like half of the chart together, right? Go back to it at the end of the day, and I'm like, I know I told that patient something. Did I tell him about dry? What was it? And now it's there for you. You're never going to lose that data again.
Yep.
So we're going to take a look at the slide here. So there I am wearing my little recording device. You can see it next to a key fob. It's not very big, so I just stick it on my scrub pocket.
And there's multiple ways to do this. You don't wear a recording device. You can have one in your exam room instead, but lots of different ways to do that.
Yeah.
But this is how it works.
And so this is what it looks like. You can see on that right side of the screen there, speaker A, speaker B. This is one that Dr. Henry and I sat down and did so that it looked nice and pretty for us. But you can see where it's picking up on the different speakers and everything that happens. And then you can see on the middle kind of part there, we've highlighted where we had that conversation. And then in that middle part there, that's what it pulled in. So it pulled in a hordeolum and all of the symptoms that he had. So it has a chief complaint. It has, we added pupils, EOMs, and then we had the exam findings, and then it's come up with, if you want to click, the assessment and plan. So it writes this up based off of the conversation that you've had with the patient. So obviously those were my recommendations to him. It translated it out of there, put it in an assessment and plan. We click the little button, boom, there you go.
Yeah, so this is just kind of that work.
Yeah.
The recording is up there on the left. It turns it into a SOAP note. It dumps it into your EHR.
Yep.
Same thing, recording, assessment, dumps it into your EHR.
Very, very cool. And, again, admittedly, I was a huge charting procrastinator. I was terrible with it, right? So I'd spend a couple hours after patient encounters at the end of the day fixing up my charts, fine-tuning them. Now, everything is done the minute I leave the room with the patient. So at the end of the day, I go home, I get to be with my family. And again, I know I've said this before, but that's priceless to me that I get to go home and have dinner and just be there instead of, typing away. And this has really been able to do that for us. And not to mention, we've been able to add 3 or 4. I think we get to this on a different slide, but we've been able to add patients.
I would just say it's amazingly accurate. It's stunning how good it does. It takes the most bizarre conversation in the exam room sometimes and turns it into this structured soap note that's perfect. You're like, how did it do that?
Well, and what I forgot to mention too was that they've actually trained this data to ophthalmology information, right? So these weird, obscure jargon that we use and these words, it knows these words. You say the CD ratio is 6.5, it will put in a CD ratio 0.65, whereas other ones are 6.5, or it doesn't know how to handle it, or it calls it 65. This has been trained so accurately to the information that applies to us. It's really, really cool.
Yeah. All right, we'll pick up speed here. We have about 5 minutes left, so let's run through the last. You want to do the AI stuff?
We'll go through this. Cool. Yeah, this is pretty cool too. So at the end of the encounter, there's document and summary assistance AI. This allows you to quickly generate really well written letters. You can change the tone and sentiment, the information that you have in there. It's improved communication. So this is at the end of the encounter summary. The typical encounter summary pulls all of the information. It's about 15 pages long. There's an AI generated summary, and you can see there it's about 3 paragraphs. It takes the important information and creates a little report that we can have. There's also the option to do outbound documents. So this is at the end of the encounter. So say this patient wanted information on flashes and floaters, right? Hey, can you send me a report with that? Yeah, typed in there. Can you write a letter explaining flashes and floaters to a patient? You can see there, that was my input. And boom, down on the bottom, it wrote a letter about flashes and floaters. So I generated a really cool, accurate letter in 13 seconds, roughly.
No time at all, right?
It's just absolutely incredible. So then you can apply it, and you'll see on the next one what the letter actually looks like. So there's what it would look like for the patient. It also stays in the encounter, so you can always go back and access that.
Yeah, it's incredible. It can take just a quick sentence and turn it into
so I've kind of already gone over the ROI for EVAA Scribe, but this is where we really got into. There's 3 docs in our practice. We've each been able to easily add, without any hiccups, without any bump in a workflow, 3 at least patients a day. So we're looking at almost 3,000 more patients in a year just by having this tool.
Yeah, so Scribe and some of the customized workflows, all that technology together.
And, again, saving time, charting, and at the end of the day, very cool. So you can see here just a graphic of us looking at if we added 2 extra patients, 4, 6, 8, 12. If we're adding 12 extra patients, again, that's where you get to that 3,000 more patients a year.
It's incredible.
Easily attainable.
Efficiency.
Yep.
All right. Last couple of things here. We're talking about post-exam. So we worked our way through using the Scribe. We're done with the exam. Patients leaving the office. Back to Eva, the virtual assistant. She can actually help the patient find things out like the order status. Like, hey, are my glasses or my contact lenses ready? So here you can kind of see, I'll just show you on the top one. It says, hey, that one's ready for pickup. That was their contact lens order. And it tells them what date it was ordered on. It tells them the bottom of that, what that contact lens order is. And then also their glasses order is in progress. So you can see on that lower right-hand corner, it's in progress. It's estimated to arrive on September the 20th. It was actually ordered on September 10th. And it tells them what frame and stuff it was, just so in case they have 2 or 3 different orders out there. So Eva can do that for us also. What else can Eva do? She can have a patient check their account balance. So they just say, hey, what's my account balance, Eva? You can see here, it pops it up. I'll make it bigger so you can see it. Hey, you owe us, J. Henry, $500. Apparently I should pay my bill.
Yeah.
But right from there, they can just click make a payment. Or if they didn't go through that process and they just said, hey, Eva, I want to pay my bill. I know I have an outstanding balance. Same thing. It's going to pop up. It's going to say you have a $500 balance. It'll also show you your family balance in case you have kids or somebody else that was in and owed money. You click the link, put in your credit card number. It posts it back into the system, pays off their bill. We don't do anything. It's automatically done for us, all in the background. Done. Also just shows up on our day sheet as a payment from the patient.
Yep.
So it can also do general questions like, hey, Eva, what are the hours of your office? And you can see there she spit out. You're open from 7 to 5:30, Monday, Tuesday, whatever. Eva, do you take VSP insurance? Yes, we do. Eva, do you carry Coach glasses? Yes, they do. It tells you all the things they want to know. So it can do a lot of interactions with the patients. You can train it to do stuff. You can train it to just read your web page, and it can automatically do a lot of this for you, so you're not sitting in the background entering all these things. Okay, real quick, kind of last thing, maximize patient engagement. This is kind of the customized messages that you can send to your patient straight from the EHR. The exam reminders, right? The recalls, that you're past due for your eye exam, your glasses are ready, those kinds of things. Directly from the EHR. You can also use this to text patients directly from the EHR. You can send birthday messages. You can do all kinds of different things. Again, saves our staff time, probably 5, 10, 15 minutes for each thing of these. But this is like the happy birthday message that we send to all of our patients. This is to confirm their appointment. Hey, you have an appointment. We send it 10 days out, 2 days out, 2 hours before. They can also click on that link to also get to fill out all that paperwork and stuff from outside or from inside their phone. We do recalls this way. You're due for your eye exam. You're past due for your eye exam. So this is how that looks when they get their messages. The order status, your glasses are ready, your contacts are ready. More advanced is the ability to text straight from the EHR to the patients. You know, this is expected from our patients almost anymore. They want us to text them. They want us to be able to interact with them via texting. Fantastic technology embedded into the EHR. And then probably the last thing I would like to talk about is just the reputation management part of MaximEyes engagement. It's fantastic. Our Google reviews have gone through the roof since we started using MaximEyes engagement. We had like 80 or 90 and we're up to almost 300. Our star rating's gone from 4.5, 4.6 up to 4.8, just because we're getting more reviews. Our reviews are almost always good. We're just finally capturing them. MaximEyes has a way of doing that for us. So sending those post-exam surveys and then getting patients to engage with our website and with Google and Facebook. So just in general summary, the big picture, workflow optimizations, efficient from start, patient scheduling, all the way to finish, patient checking out, and then patient gone from the office, still efficient. Works 24/7, doesn't call off, never sick, doesn't want a pay raise, doesn't complain, works for you constantly to help your efficiency. It's also accurate, makes things better for the whole process. Takes away the friction points, makes staff happier, makes patients happier. You know, let's just talk real quick, a summary of what these are, the full suite of basically MaximEyes AI. It's all powered by EVAA, the cute little EVAA up there in the corner. But we have the virtual assistant, which did the scheduling, the intake forms, the patient communications, the order notifications, the bill pay. We have the billing assistant, which pulls in all the insurance authorizations. We have the EVAA scribe. We have the IntelliScan. All of those save us money, right? All of those make us more efficient. We already talked about it. Probably with the virtual assistant alone, we're saving 320 hours a month of staff phone time. The billing assistant, 4+ hours a day, probably pulling in 60 to 70 patients a day. The scribe, we already said, we're adding 3 or 4 more patients to our schedule every day with 3 doctors. That's huge. And then the IntelliScan, a few minutes per patient just by not having to do all the typing. Okay. So that's where the power of AI is. We're using it. We love it. I can't imagine, you know, where we're going to be in another few years with this stuff. Yeah. It's just gaining traction. It's the future. If you're not adopting it, you're going to get left behind. You have to get on board. Go to their website, get the information. If you're already a customer of theirs, you owe it to yourself to at least invest in doing this. If you're not a customer, talk to them. Thank you guys for attending. We appreciate it.
Thank you.